All right, everyone, welcome to another exciting episode of Telling Medical Stories, where I bring you healthcare professionals from around the world to help you as a medical student make amazing medical decisions. And if you're a doctor, just to give you information about what is happening around the medical world and also help you navigate through your medical career. And today we have back again here Dr. Timileyin Adeosun Emmanuel, a general practitioner in Lagos, Nigeria. Okay, so we're not going to be doing all the introduction. If you want to know more about him, please check the link up below here and you'll be able to see more about him and my first discussion with him. So we're going to go straight to the point. Today's video, we're talking about doing our internship in Nigeria. Okay, so the train landed us after as a foreign medical student, or you studied in Nigeria, and I'm supposed to do my internship, okay, in Nigeria, or I'm a medical student studying outside Nigeria, and I'm looking forward to coming back home to practice, which we already dealt with several videos, okay? So watch other videos to know if it's a good idea or not for you, or if it's suited for you. So watch that video. But if you have made up your mind to come back home, this video is going to give you all of the information that you need. All right, so Dr. Timmy, I'm going to be asking you a series of questions I've gathered from people, so I hope that you'll be able to give us the honest advice. Remember, this series is all about honesty and allowing people to make decisions for themselves. So I guess we can't say everything online, but as much as we can say to help people is needed. So thank you so much for joining me again. Yeah. All right. So question number one. How can a foreign trained doctor be eligible for internship in Nigeria?
Okay, for a foreign trained doctor to be eligible for internship, you have to have passed the Medical and Dental Council of Nigerian exams that is arranged for foreign trained doctors. And I think the exam they do it twice a year now in Nigeria, in different venues, different parts of Nigeria, different states of Nigeria, and it comprises of both clinical and basic science knowledge.
Great, fantastic. So guys, if you want to know more about the MDCN, I have a video that talks about the preparation, the techniques, everything that you need to do to pass the exams. And also I have amazing content on how you can get trainings with professional people who do this training in Nigeria in different places across the cities, Port Harcourt, Lagos. We also have in Abuja. So and other places, just search around the content and the playlist, you'll find that. So you must pass that exam to be eligible. But can you give us a sneak peek? If I was really serious with my medical school studying abroad, what's the difficulty level of the exam compared to other exams, medical exams?
Okay, now the thing about the Nigerian exam is not even about sometimes, although they test your knowledge, they also test your skill on how you can handle pressure in an examination arena. You understand? So the very technical part about those examinations is how fast you can answer questions and how well you understand the questions that are given to you. Some people know the answers, but sometimes they don't understand how to deliver the question, or they didn't even read the instructions properly. I will just quickly share an experience of mine during my own examination. One of the stations, the second day of examinations, where we call it the OSCE stations, where we were supposed to on the paper they told me to counsel a woman. Instead of, I didn't even see the counsel. All I saw is a woman with fibroid, and I started taking history. and I was already 4 minutes gone out of 5 minutes given when the examiner said, "Look at your paper."
Yeah.
You know, I just started. I was what they call that English, discombobulated.
Oh, discombobulated. Okay, well done.
Yeah, I started rushing. I started counseling the woman. I shall counsel what I could counsel in 1 minute. So those are the challenges we have when especially in those exams. So I believe if you prepare with the appropriate materials, you are good, and you now have to be intentional about your practicing when it comes to the oral parts. You have to practice actually. Yeah, because medicine actually, for you to be a good medical doctor, you have to have practice for a long time. That's what I call it practice. So you have to. It takes practice to actually overcome those stages in the exam, and you'll be okay.
Great. So when I pass the exam, I'm given a provisional license. Is that true?
Yes. Provisional license.
What does that mean?
That means that yes, you are now licensed to practice. The provisional license just gives you an avenue to be trained to undergo what we call internship or housemanship. Become a house officer for 1 year.
Currently now, let's put that this is 5th of June 2021. How the provisional license at this time is for how long? 1 year, 2, 3, 4, 5, 6.
Okay. For us, foreign trained doctors, it's for 2 years.
What about for indigenously trained, locally trained doctors?
Indigenous, I think it's 1 year plus. Just one. I think it's 1 year with an option to extend if necessary.
Is that also available for the foreign trained doctor to an option to extend?
It's not available.
So, what happens if in the space of 2 years I don't do my internship? I have to retake the exams.
You have to write the exam.
All right, great. So that's just out there. All right, so let's go straight. I passed the exams. Please watch the video on passing the exams and every other thing. And then I have my provisional license, and now I need to search for a place for internship. How easy is that? Does MDCN provide for me a place to have my internship or housemanship? Is it provisional? I have to look for a place myself.
So under normal circumstances, and I repeat, under normal circumstances, they're supposed to find for you. But it is what it is. You have to go out there and find a placement for yourself. Now, my advice is for you to go to states that actually need doctors. Although some people prefer to stay in the big cities where they can have access to a lot of things. How mega city works, and especially those of us that come abroad. You don't want to go to all these rural areas and stuff. But for the other states, there are some states where you just go there and apply, and it's like almost automatically you get placement. While there are some places you have to wait months, write exams and stuff, and it's not even guaranteed. Another way is the way of the highway, where you will know someone.
So you say the highway. Interested. Wow. Please simplify for us. What's the highway? Is that what they call connection? Connect?
You understand me? You know somebody that knows somebody that knows somebody that has authority in the right places where they can give you placement. That's what I'm talking about.
Oh, all right. I know that you can do your internship in both federal and state hospitals. So, what's the difference between the federal and state hospitals?
So, for the federal and state hospitals, most federal hospitals are teaching hospitals. Yes, most of them are the federal medical centers in those the states. Then the federal medical teaching hospitals owned by each state also are places where you can get placement. So in those places, they have more specialties. They have more specialties actually. You understand? Where it's like a full medical tree. You know, the branches and everything. There you have all departments there. The oncology, nephrologist, internal medicine, general surgeon, obstetrics and gynecology, pediatrician. You know, you have all different fields of medicine most times are in those places, and you get the consultants of those fields present there. So you train most times under those consultants in those federal settings, and it's what we call the tertiary centers. Most federal hospitals are tertiary centers in Nigeria. Our state hospitals, they are mostly secondary and primary. For you to say a state that is tertiary, is either the state is a state-owned teaching hospital, or which not there are a few of them in Nigeria. Maybe the states that have universities that offer medicine that have this kind of facilities. So if you are going to a federal facility, you tend to gain more hands-on practice on different fields of medicine. While in the states place, it's more secondary. It's headed by consultants, and there might be few consultants for some specific, maybe for O&G, pediatrics, and all those stuff. They are there. There are some states that have O&G hospitals, pediatric hospitals, and all those ones together, but they are not like centralized. Some of them are decentralized. So if you are working there, you might have to be rotating those hospitals one after the other. But the federal case is more of the centralized system. So those that have done can understand.
Oh, nice. All right. So, someone was advising that if you're looking for your housemanship, don't just joke. Just look for one in your state or where you are from, where your family, where they are. Okay, I think that's something to consider. Do you want to go to a place where you're away from home, or do you want to go to a place where you are close to home? But do you think people should just take that advice? Because the normal system, I believe, is apply to hospitals, write exams. How does that even work? Is there a hope in just applying and writing exams? Do people really get selected from just the normal process of writing exams, taking interviews?
Yes, as funny as it may sound, it actually works for some people. And like I said, there are some places that they really need you doctors, and they will actually take you. But my advice is not to put your head in one basket, because most people they are determined that okay, this is where I want to do my house job. It is here or nowhere. So they are not even open to the place they are not open to the fact that they can go out there and check for other opportunities. Now, I feel that if you are thinking of proximity when it comes to your internship is just 1 year. If you want to wait that long after going through the rigorous process of passing the exam, and you wait 6-7 months before starting your house job, I feel it defeats the purpose of you coming and saying you want to be a doctor. Because you know, So if I were you, I just want to start where I get my hands on. Because I know it's just
So
one year.
it's just for 1 year. So you're just trying to say, take whatever you have and just do a safe
Yes,
year and move on with your life. And that's fair enough. So what about the payment for internship? How is it?
I like keeping a straight face for this kind of question because I don't also want to look at me as if currently there's an issue with
the new law.
The current scheme of payments for medical interns. We were using a very balanced system where they use the level system, and they start with, I think they started with level 12 or 13, I can't remember, for doctors that are doing their housemanship. So it's like they start with this salary scheme, or that they use for people that are already in service.
Civil service, yeah.
Yes, they're already in service, and they use that scheme they just put it in a level where it's conducive for everyone. The pay was not that much, but it was quite okay. You understand? But now they scrap that, especially the federal, especially those in federal. They scrap that, and the Medical and Dental Council of Nigeria have decided to pay or the doctors, or to give them the so-called stipend for their internship. So if you are coming to Nigeria now, you think you can gather money to do something with your internship money, you might be disappointed.
So you're saying save up for internship, and you're also telling parents to still prepare to at least support your kids when they're still doing internships.
Don't get carried away the fact that they're calling them doctor up and down.
So I think that boils down that if you're watching this video early enough to have some savings, I think that's one thing. The money you used to cruise, to go to McDonald's, to go to KFC, to be fresh boys around, to buy clothes, save it for your internship, okay? It will be good to have emergency funds and those things.
Yes, and you might need to write exams and stuff. You might need to be on the move. Don't allow those funds delay you.
Yeah. Oh, that's good. That's good.
1 year is a lot of time to do a lot of other things. Yeah.
So how rigorous is the internship?
Wow. Some people have likened it to, they've removed the house officer and called it to house boy, house girl. Because basically you're doing every dirty job that a doctor can do in the hospital, especially when in those teaching hospital arenas. Those ones you are the one chasing blood samples. You are the one reminding the patient to do this, to do that. You are the one giving IV drugs. You are the one going to the lab to collect the results. You are doing everything. But sometimes that 1 year is just a year of stress.
So it is very important for you to be humble. Yes. The spirit of humility, you must take it to your internship. You must not raise your shoulder to the hospital.
No, you cannot even do that.
But I trust they'll clap, even if you raise that. I trust they'll clap you down. There's nobody will tell you to.
You will be humble because there's something called extension without pay. And that was even when they were paying, not now that they're giving stipends.
And now so extension with I'm looking for a very thick term to call it, but I think it's not funny. It's not funny. Wow.
Yeah.
Great. So what are the do's and the don'ts when you're starting your internship? What are the things that somebody has passed their MDCN, they're about to start their internship or housemanship? What will you tell them? See, these are the things you should do, and then don't even try to do this. So let's start from the do's. What are the do's? What are some of the things you advise?
So the do's for when you start internship, when you are about to start a posting, If it's a pediatric posting, O&D posting, please be ready. You know, be ready to be asked any question concerning that field.
Okay, how can I be ready?
So, just have a basic knowledge of everything. At
And
least
if I don't know the answer?
If you don't know the answer, have a basic knowledge.
But what if the person doesn't have a basic knowledge? Well,
if you don't have a basic knowledge, be very humble to say you don't know.
Yeah.
Be very humble to say you don't know. Don't be arrogant about it. Some people expect you to know things that even resident doctors don't know. But don't be arrogant about the fact that you are not supposed to know this, or you know the field, you are not interested in this field. You are just doing it because you have to take this place, this poster. You understand me? So just have a basic knowledge of where you are being, the department you are being posted to. Be able to have a full grasp of what they are doing there. Then other rules that you should do is that always have your own rounds with the patients before the elderly colleagues come. Yeah, because it's very important. Don't be clueless about your patients. Be the first person to know about the patient. And I think you'll be well. Don't try and run away from work, because they actually say all those things. Then they do not reply your immediate senior in the practice. Do not
reply. What do you mean by not reply? If they ask me a question, you don't say what?
No, do not arrogantly reply them, or when they are angry or anything, don't confront. Don't be confrontational.
No, but you're just coming from maybe abroad where you can tell your teacher that's not it, that's not how it is. You argue your way through, so that's not allowed.
It's allowed if you are ready for extension and if you don't want to sign your papers on time. It's very allowed.
What if I disagree? That's sarcastic. What if I disagree with what they are saying, or I feel like it's unfair? I just have to be able to just keep quiet because I want to avoid extension.
I think, especially in Nigeria, I think everywhere medicine has hierarchy, and you cannot be arrogant when it comes to your clinical career practice. You should just remain humble and learn. You understand? Even when it seems like when there are some situations where it seems that it's like the immediate head is not professional enough and all those things, please don't confront. Instead, report to. There's always someone above that person. There's always someone above, even if the person is the head of the hospital. There's a body that is responsible for that person. So you can always report.
Any other don'ts? What about dealing with other hospital staffs, like other doctors, nurses, and every other protocol that exists?
When it comes to nurses, be professional. Make sure you do your job. Don't get too familiar with them. Although it's good to have a good working environment, but also place priority in the work. Let the work be very, very professional, because when sometimes it is during this the doctor-nurse relationship that negligence sometimes comes in, and for you to be sure that you are clear from that, you have to be very professional when it comes to handling the nurses, even the cleaners, anybody that works in your hospital, down to the people that handle the medical records, to the laboratory and all those things. Be highly professional about your work. Don't get too familiar with people that they get so comfortable around you and they feel they can be negligent around you. Because at the end of the day, no matter how small or low the hierarchy of the doctor is still above every other department.
Yeah, but I heard the statement that is really popular that It's the nurses that will teach you. They're your first teachers in the hospital
With the
and
fact
all
that
those stuff.
they will teach you, they will actually teach you, but when it comes to making the final decision, you're the doctor, you will be the one that makes the final decision. They will teach you about this. Oh, yes, this. So should we do this? If you say yes, then it's on you. If you say no, it's on you. So when they are teaching you, you should also, for God's sake, you are not the dumb. It's not like you didn't go through medical school. You might not be good in some practical aspects, but intellectually and due to training, you are superior. So at the end of the day, you are accountable to everything you do.
All right, great. I think that's a wonderful perspective to look at it. All right, so next question I have here, it says, what are the challenges that foreign doctors usually face during internship?
It's the challenge of the bias you already have, your senior colleagues will have against you, that you're not serious. Maybe you didn't undergo in proper or adequate training in medical school. Those things will. So sometimes as a foreign trained student, you have to work extra hard when it comes to reading, preparing for ward rounds and all those things. You have to prepare more than the average doctor, Nigerian doctor, and you have to put more efforts and show that you are not what they think you are. It's more difficult, but it makes you a better doctor.
Yeah. Wow. So do I really need to show that I studied? Do I need to? What if I just want to be myself?
You can be yourself. You can be yourself, but it depends on the kind of, the kind of image you want to portray to those in front of you, the senior people. Because at the end of the day, you need them for one reason or another. You will need them to sign your release forms. You might need them as referees in future and all those things. So you have to put up a good attitude, even when you feel like the stress is getting too much. For me, that's what I do. Hard work pays.
All right. I want to ask a question. Let's say, for some reason, I wasn't so serious in medical school. I roughed my way through, and then I also roughed my way through MDCN. Just struggle, read the books, and pass. And now I'm doing my internship, and I really know that I don't really know much. I'm ready to put in the work. I am this person that they have said has studied and didn't really study well. So, what will be your advice for me? I'm acknowledging that I don't think I know much about what's going on. What will be your advice?
So that's what the internship is all about. That's what the internship is all about. There's something common they say in medicine here. It's the common things of commonly. So you're going to see a lot of cases. You're going to get hands-on experience. You are going to get good clinical experience and practice that will even guide you in the knowledge of those things that you feel you don't know. So all you have to do is just show up and be ready to learn. You'll be surprised. Those things that you felt seem difficult and you're rocking yourself, it starts making sense. Someone was like a medical school, it's like you're throwing a lot of trash, outside the bin. And when you start practicing, all those things you thought was trash will just start coming together into the bin and start making sense. That's what happens when it starts. So
no need for worries. With practice, like you used earlier, you get better, right? It's good. I've seen many people that were not academically sound really evolve to be really good practical doctors. And I think there's a chance for that. When it gets to on the job, I think sometimes some people evolve to be better, some maintain their status, and maybe some academicians are not necessarily going to be hands-on very good doctors. It's really very possible.
Yes, it happens so much.
So take us through the rotations. How many internship in Nigeria? It's 1 year, you said, right? And then we do it in rotations, right?
Yes, so it's 4 rotations, and 4 rotations. You do it for 3 months. You do each rotation for 3 months, then you go to the next rotation. So that's the total of 12 months in 4 rotations. So for O&D, you do 3 months. For pediatrics, you do 3 months. Surgery, 3 months. And medicine, 3 months.
What was your worst rotation? And why?
Worst rotation.
Pediatrics?
I won't say worse. No, pediatric was good. O&G was stressful.
Surgery?
It was very stressful. Yeah, I'll say medicine.
Why?
Because medicine it's more internal medicine. It's not for surgery. You know where the problem is, and you're taking it out. O&G, you've seen the issue. It's either pregnancy or woman matter. Take it out. Do that. Do this. For pediatrics, you take care of the problem. If it's very serious, you refer to the surgeons. You do this and that. But for internal medicine, there are some cases they are very atypical. They are not textbook cases, and they become very difficult, even in management. And those cases become very challenging as a doctor. Challenge you as a doctor, and that just made that particular rotation very difficult.
Yeah. So, will you say that during your time for internship, you had time for other things in your life?
Yeah, where I went to do my internship, I didn't do my internship in a federal facility. I did it in a state facility. So the calls were not as frequent as those that worked in a federal facility. I was able to write some exams, get married, other things. Yeah, I was able to read more. Yeah, I was able to go watch some movies. I was able to go for church programs and stuff. It was really nice one.
Oh, great, fantastic. So, in one statement, how will you summarize internship in Nigeria?
Internship in Nigeria is a good experience.
Is it Grey's Anatomy experience?
No, it's not Grey's Anatomy.
Since I practicing in Nigeria, have you had that Grey's Anatomy?
No, Indigo Anatomy.
Because I know some medical students still have that, Grey's Anatomy,
My brother,
maybe even
it's not Grey's Anatomy. Someone will just come from pediatric posting and say, Bamio, you my child will come help you. And that is the emergency. And you're like, and although the facilities are not there, but the experience is there. The ability to use your initiative and to be able to think outside the box in a short period and try to use what is available to give the patient the best care they can have. It's something magical, and that's why the statistics shows that Nigerian doctors do well when they go abroad and get better opportunities and facilities to work.
Because they've learned and worked with crude methods and then really have adapted. So now
very conditions.
So what are the benefits of doing my internship in Nigeria? After internship as well, what's the way forward? What's next? What are the possible options?
After internship, you can go for your residency. You can write the West African exam or the national. That's the Nigerian exam for residency. Or you go abroad and try to apply, write their professional exams, write for the USMLE in US, the MCAT in Canada. Those are the most popular ones. There's the club in the UK and the MRCP in UK.
Yeah, all right, guys. Yeah, no problems. We have links for those particular exams here, and we'll talk with doctors as well who have gone through the process, either from going through the Nigerian route or those who went straight from wherever they studied, or how to move on if you studied in those countries. All right, so thank you so much, Dr. Doshi, for being here with us today and giving us all the information. So guys, like, share, subscribe to this channel for more topics. Yeah, and see you in the next video. Bye.
Bye. Thank you so much.
All right, before we end, I have one question for you before you can go. I just want to see where I can add it. How is it being a young married man and being a doctor? What are the challenges? What was it? Actually, it's a very serious question. I want to know from the male perspective. Let me see how the question went. Okay, let me be very sure. Okay, I just want to see the male perspective to read. It said the person was saying that as a lady, my family and friends have been telling me to get married before I do internship and start specializing, or else it will be hard to get married when I start. Okay, that's for ladies. Most times, maybe I think both guys and girls work for marriage, but depends. So, how do you think? Do you think a guy should get married before internship, or during, like for you, did you during internship and all those stuff? What do you think? Marriage and young medical life and career. How do you?
I think it's something very personal, because you can't, when it comes to marriage, when you feel you're ready, it doesn't matter what's ahead of you or what's behind you. If you feel you're ready, then you're ready.
But it's really challenging.
It's very challenging. I don't know about that. It's challenging. Some people get married during medical school. And I have a lot of friends like that. I got married during the medical school. They made it work, although it came with their own challenges. But so I believe it still depends on your own resolve and how you can handle situations. There are some people, they cannot even handle their 5 to 5 lectures. They start feeling depressed and all those things. And those kind of people can't really think of marriage. So if you know that you are not even in that headspace, you understand. No matter how you are, I don't think you should still think about marriage. If you feel you need to attain some goals before you get married, then please go for it. Don't succumb to the pressure. Yeah, I had goals for myself. I was saying now, if I said I'm going to get married, and I made sure I achieve those goals before I said I'm going to get married. And I knew that, okay, when I get married, these are the challenges I'm going to face. And I already thought about it. And, you know, I've already looked for, okay, how I'm going to work around this situation.
Yeah, I think that's a perfect answer. And I think you just have to do the maths for yourself and know what works for you and what you can handle. But if you're wondering if it's a possibility, then he's saying yes, you can be able to juggle each and every one of them. So if you have any questions concerning this, you can put in the comment section. We can continue a discussion more and more on that part. And for the lady part, I'm getting the lady professional. The video is somewhere also in this playlist. So you can go there as well to watch. She is a professional consultant in Nigeria practicing, and she's married as well. So you can see her take on this particular topic. So thank you everyone for.
Thank you very
No,
much.
I think this part is a part of another video. We're all finished. Thank you. I'll add it to